let's give you a global perspective. We do know, following all these updates we get on the site of the Ghana Health Service and also from the address of the President, Nana Addo Dankwa Akufo-Addo, that as a country, we've recorded 214 cases, majority in Greater Accra. But in the meantime, we have to look at the global perspective of what the update is. And so far, we're just climbing as a globe. We have 1.27 million. So we have 1,275,542 and counting, because this is real-time data. It will be updated in real time. So up to the minute, maybe 2 minutes, 3 minutes, 5 minutes, these figures ultimately will change. The total death, though, from all these global infections are 69,500 and counting. And then also we have at least 260,000 people recovering. But this is just 1/5 of the numbers. It used to be 1/5. Initially it was 1/4. So it looks like the gap is just widening by the day. The U.S., that is the United States of America, is still leading with the number of cases. And you can see from the pictorial mapped representation where the number of cases are. The United States of America, within the continent of North America, has a lot of the red spots. And up there we have a couple of spots also in Canada. And so you find all of them: New York, Chicago, Detroit area, Houston, Miami, Los Angeles, San Francisco, Denver, in Colorado, and then also Seattle. All of them hotspots, epicenter. The United States now is the lead country for the number of infections we have so far. But in Ghana, the Upper East region recorded its first case. But so far, there's every indication that the regional hospital will be closed down. Albert Sorry is a man who monitored that situation from officials or management of the region. Would want to go to him as part of our update on what really has been transpiring in the region and efforts of the authorities. And good morning to you, Albert. We try collecting the right data and connecting to you. So far, what can you tell us based on the decision to close down the regional hospital, Albert?
Yes, Roland. So they are doing the disinfection exercise today. In fact, the regional health director says that it is the right term is decontamination. And basically what they are going to do is to ensure that the staff who work at the maternity units and other people who may want to come and seek healthcare later there will feel safe, will not have any fears that the place is still infected with the virus. So it's going to be a really simple process. In fact, what he said was that based on science and what he knows about this virus, he could say on authority that there is nothing infectious in the ward, but they still need to do it nonetheless. And if they use a substance he calls 0.5 chlorine to do the decontamination, within a matter of 10 minutes, the ward should be safe for people to use it. But then, because they are going to have to move the patients who are currently there, they'll just do that today, and then tomorrow, normal duties will resume at the ward.
There's a related issue of how the traces are done for many of the cases, and the Ghana Health Service, and particularly the updates from the information minister, have been handy. How have traces been done so far for this particular case, if you have any update?
Yeah, so what the regional health director said was that usually contact tracing is difficult to do. It's going to take them some time to be able to trace everyone who have come in contact with the woman. But at the moment, they have 11 of those people whom they have contacted, and they are taking them through the process of, observing and testing them to see if they have the virus. But um, he said that in the coming days, the woman is said to have traveled somewhere in the western region, and so they are also liaising with authorities there to see the bus that she traveled with, and possibly if they can trace some of the people who may have used that bus. Remember, it's been more than 2 weeks since the woman went to that place. So because of that, he has given the assurance that they are trying as much as possible to trace everyone who may have had contact with the woman. But it will take time before they are able to get in touch with everyone, because sometimes patients even tend to forget every single person that they have met along the way before their test results came out, or before they even know that they have the virus. So this is the challenge. But that assurance is there that they are tracing and trying to contact everybody. They know based on interviews they are having with patients to bring them in test.
That's what we have to leave it, Albert. Sorry, but make sure that you keep tap on this, and let's get all the updates for regular programming right here on the channel. But that's Albert, sorry, our lead correspondent in the Upper East region. And that concludes our update on coronavirus and all that has been happening so far relating to the world, and then also what efforts have so far been done by Ghanaian authorities. But it's time for us to give you our latest update on coronavirus and what all of us need to do by way of caution.